Basically, I went into medicine because I like taking care of people and helping people. And so I feel that this specialty allows me to use what are the best of my abilities to do that. I'm a plastic and reconstructive surgeon. So my patient population typically is made up of patients in need of reconstructive surgery. One of the reasons I really love breast reconstruction and why I make it a focus of my practice is definitely because it is very rewarding to help a patient out in a very trying time. The diagnosis of breast cancer, is definitely a life-changing event. Being able to sit down and kind of discuss what our options are, but also let these patients know that treating and curing their cancer is the #1 goal. But then I also get to develop this relationship with these patients that lasts more than just for that treatment. I end up, following them longer than the breast surgeons typically. And on this day and age, there's all kinds of different ways that we treat breast cancer. And so sometimes that involves surgery first, sometimes that involves chemotherapy first. It may or may not involve radiation therapy. So there's a lot of factors to take in. And so I definitely not only have to communicate well with the patient, but I need to communicate with the other members of the team so that we're all on the same page. I do a lot of breast reduction surgery, and that's a very satisfying surgery as well. They have back and neck pain, they've tried physical therapy, they've seen the chiropractor, they've taken medications, prescription medications sometimes, and nothing seems to help. And we do that surgery to remove that weight and literally lift that weight off their chest. Patients I see are patients that require body contouring after massive weight loss. I do a lot of skin cancer surgery, including melanoma surgery, and then I also see patients in the wound clinic and see a lot of the wounds in the hospital. What I like to do is give patients the time and due respect to listen to their concerns and their problems, and then work with them to find the best solution. So outside of here, I spend a lot of time with my kids and my family, my wife.